Hi everyone, what do these magnets and this balloon have in common? The answer may surprise you. Unless you've read the title of the video. You know it would just be hilarious, just absolute comedy gold? What if I inhaled some of this helium and talked with a squeaky high-pitched voice? Oh man, can you even imagine? Alright, I think I'm going to do it. Get ready for this. Just breaking new ground in comedy. I made a house. I'm Dr. Josh Jarvis, radiologist, and today we're going to talk about MRI. But first, here's the standard disclaimer. Actual medical images may be used, but all personal information has been removed. So what is MRI? MRI stands for magnetic resonance imaging, and at the most basic level, MRI involves using a magnetic field to make images of the human body. Or, I guess it doesn't have to be human. I suppose you could put a cat or something in there. Probably have trouble keeping it still. Very loud too, so the cat would probably freak out and climb a wall or something. But anyway, I'm getting ahead of myself. You could probably sedate the cat, I suppose, but I don't really... I mean, are there kitty anesthesiologists? So using magnets to make pictures. Now, what kind of magnets are we talking about? Well, the MRI uses super high electrical currents to create a crazy strong magnetic field. Now, how strong? Well, modern MRI machines have a magnetic field strength of about 1.5 to 3 Tesla, which is equal to 15 to 30,000 Gauss. For comparison, the Earth's magnetic field is around 0.5 Gauss, so the magnetic field of an MRI machine is about 60,000 times that of the Earth's magnetic field. Now, okay, maybe that doesn't sound that impressive. It's not like if you throw a handful of paper clips up in the air, they'll fly to the North Pole. Well, how about this? You know those junkyard magnets that can lift cars? They have a field strength of up to around 1 Tesla. Still not as strong as the average MRI scanner. And because the magnetic field is so strong, strict precautions have to be taken to keep unsecured metal objects from flying around and hurting someone. I highly recommend searching for MRI versus stretcher or MRI versus floor buffer. There are a ton of crazy pictures and videos out there. And since I don't own any of those pictures, enjoy this dramatization I made out of Legos.
Hey new guy, I need you to take this wheelchair down to MRI.
Sure. Anywhere in particular I should put it?
I don't care, just get it out of here.
Whistling in an oblivious sort of way. Totally unaware if anything is going to happen.
Hey, you, go clean the floors down in MRI.
Yes, sir. Right away.
Well, I'm hot-blooded, check it and see. I got a fever of 103. Hey, take this go-kart down to MRI.
Why does a hospital have a go-kart?
Just do it. Hey, before you leave today, I need you to take this barrel full of dangerous, sharp metal implements down to MRI.
Okay.
Wait.
Yes, King Triton?
Take my trident down there too.
No problem. So how do we use these super strong magnets to make images of the body? Well, if you put certain materials within a magnetic field, they'll absorb and transmit radio frequency energy. In the body, hydrogen ions are the primary source of MRI signals since hydrogen is abundant in water and other tissues in the body. Hydrogen ions are like little magnets, and when placed into a strong magnetic field, they will tend to line up in parallel with the field. The stronger the magnetic field, the more hydrogen protons will line up, which improves the MRI signal. So when you get in the MRI machine, your hydrogen ions will line up with the primary magnetic field. We then add additional radio frequency pulses, which knock some of these hydrogens out of alignment. Once these extra energy pulses are turned off, the hydrogen ions will then begin to relax or realign with the primary magnetic field. As they're relaxing, energy is being emitted, which we can measure to help make an image. Since the magnetic environment within different tissues and body parts can affect these hydrogen ions in different ways, the time for the hydrogens to relax varies depending on the tissue. We can then change the time when we are measuring the signal to either maximize or minimize the differences between different tissues. And that's where all the different MRI sequences come in. There are nearly limitless ways that we can vary the time and how long the radio frequency pulse is being turned on or off. When we decide to take a measurement of the signal, how many measurements we take, how many times we repeat the pulses and measurements, all these variables can be changed to create sequences tailored to evaluate specific tissues. Let's take a look at some examples of some of the most common sequences. Here are some T1 or T1 weighted images. To keep things simple, don't worry too much about what T1 or any other the names of these sequences stand for. On T1 images, fat is bright and fluid is dark, as you can see on this T1 abdominal MRI image where the intra-abdominal and subcutaneous fat is bright and the fluid within the gallbladder is dark. When imaging the brain and central nervous system on T1 images, the white matter is white and the gray matter is gray. Here are some T2 images. On T2, fat also is bright, but here fluid is bright as opposed to dark as seen on T1. This T2 image of the pelvis shows bright intra-abdominal and subcutaneous fat and bright fluid within the bladder. In the brain, white and gray matter are reversed on T2, with white matter dark and gray matter bright. Certain sequences can also decrease or eliminate the signal from certain tissues. Fat saturation is one example, where the signal from the fat is suppressed so that it's no longer bright. This is particularly helpful when giving IV contrast, which shows up bright on MRI. By suppressing the fat signal on sequences where fat is typically bright, such as T1, the contrast is less likely to be obscured by the fat, making it easier to detect abnormal areas where the contrast might collect. Here are some T1 images of the upper arm without and with fat saturation. You can see the fat is darker on the fat sat images. Similarly, certain sequences can suppress the signal of fluid. Here's a T2 image of the brain. You can see that the cerebrospinal fluid, or CSF, is bright. On this flare image, which is a sequence that suppresses fluid, you can see that the CSF is dark. This is helpful because, for the most part, only the normal fluid is suppressed, making abnormal areas of increased fluid stand out. There are a bunch of other sequences as well, with new variations being developed every day. But before I move on, one last sequence I wanted to mention is DWI, or Diffusion-Weighted Imaging. In a very basic sense, DWI works by detecting the motion of water molecules. In normal tissue, water is present both inside cells and in the extracellular spaces and can move around relatively freely. When water no longer moves around freely, it is said to have restricted diffusion, which shows up bright on DWI images. The most common use for DWI is for detecting a stroke. A stroke is basically when a part of your brain dies, usually due to a lack of blood flow. Since dead or dying cells lose the ability to keep the water molecules inside and outside the cell in balance, water floods into the cell, causing swelling. Since the water is trapped in the cell, it can no longer move freely and has restricted diffusion, which we can detect relatively early on with DWI. Since there are all these different sequences, MRI can be very difficult to learn how to interpret, which is one of the reasons radiology training is so long. So that's how MRI uses magnets to make pictures, but what about the helium? Well, the electrical current required to maintain the magnetic field is so high that under normal circumstances the resistance in the wires would result in tremendous amounts of heat and the whole thing would burn out. However, if you make the wires cold enough, the resistance to electrical current drops to zero. This creates something called a superconductor. Helium exists in its liquid form at 4 Kelvin, which is equivalent to about -270 degrees Celsius or -450 degrees Fahrenheit. So by surrounding the coils with liquid helium, you can create a superconductor which maintains the super high magnetic field. So that all works out pretty good, but one thing not a lot of people know is that we're running out of helium. Our current helium mines are being depleted and there's really no other way to make it. So think about that. Those party balloons you blow up today could cost you a life-saving MRI tomorrow. Oh, this is for work. So what are some of the advantages of MRI over other imaging modalities? Well, the biggest strength of MRI is its soft tissue contrast, or ability to distinguish between similar but slightly different tissues. As I mentioned in my X-ray and CT videos, just like CT is much better for looking at soft tissues than X-ray, MRI is much better than CT. This is particularly true when imaging the brain and central nervous system. Here, take a look at this head CT. CT does a pretty good job of outlining all the folds and creases in the brain and does a great job evaluating the bones and other calcifications, but differentiating between gray and white matter is somewhat challenging, and abnormalities with similar density to that of the brain itself can be obscured. On MRI, differences between gray and white matter are much more distinct. Plus, the various sequences such as FLAIR and DWI help to identify abnormalities not visible on CT. Here's a patient with a brain mass. On CT, you could see some subtle irregularity, but on MRI, this mass is much more obvious. MRI is also great for evaluating the soft tissues of the musculoskeletal system. Here's a CT of the knee. Evaluation of the bones is decent, and if you adjust the settings, you can get some idea of the internal soft tissues of the knee joint. But again, MRI does a far better job of distinguishing the soft tissues such as the menisci and ACL, all structures that are commonly injured and may require surgery. Here's an MRI of an ACL tear. CT just doesn't have the soft tissue contrast to assess soft tissue injuries like this. Another advantage of MRI is no radiation exposure. Since images are made with the magnet instead of X-rays, MRI can be a great option for children, young adults, and even pregnant women without the risks of ionizing radiation. But, as with anything, MRI also has its disadvantages. Given the strong magnetic field, MRI often can't be done in patients with pacemakers, metal-formed bodies, or certain other metal implants. Metal workers often need to get an X-ray of their skull before an MRI to look for tiny metal-formed bodies in and around their eyes. If you've seen what an MRI can do to a wheelchair, you can imagine what a tiny metal shaving can do to a soft, jelly-filled eyeball. Another disadvantage is the potential for claustrophobia. MRIs take quite a bit longer than CTs to acquire images. While a CT typically takes less than a minute for the actual scanning portion, MRI exams take anywhere from 15 minutes, a half hour, to several hours to complete, depending on how much of the body we're imaging. Since the tube the patient goes in can be somewhat cozy, spending that much time in such a tight space can cause some patients to panic. Also, since MRIs take so much longer, there's greater potential for the patient to move, which can significantly decrease image quality. Some patients, either due to altered mental status, pain, or anxiety, may need to be sedated or put under anesthesia to get a quality exam. Lastly, MRI is quite a bit more expensive than CT and can be relatively limited in availability. So that's a very basic overview on MRI, which can be an incredibly complicated topic. Hopefully you learned a few things, and as always, like, comment, and subscribe, and check out my other videos for more excellence in radiology entertainment. I'll see you next time. Oh, it was just regular air the whole time. Comedy crisis averted.